Heat shock protein 90 is a unique target because by inhibiting heat shock protein 90, you can actually get to a number of key oncoproteins that are critical for the cancer cell. So inhibiting heat shock protein has been an ongoing effort for 2 decades, but now we finally have a drug that has shown in a randomized trial to improve the efficacy of chemotherapy in advanced stage lung cancer. So when a protein is newly synthesized in the cell, it's almost like coming out on an assembly line. It has to associate itself with heat shock protein 90, and then it undergoes the activation process. There are more than 200 proteins that have been described in the literature that are dependent on Hsp90 activation, interaction. So by blocking Hsp90, you're able to knock out the oncogenic functions of many of these oncoproteins. Yes, this is exactly right. Heat shock protein is known as the chaperone, and we refer to proteins like EGFR, ALK, HER2 as client proteins of Hsp90. It plays a very critical role. It accounts for almost 1 to 2% of all cellular proteins are heat shock proteins. Ganetespib belongs to what we refer to now as the second generation of Hsp90 inhibitors. It is administered intravenously. We give it once on day 1 and day 15 of every 3-week cycle in this particular trial. It's tolerated well. The most common toxicity you see is diarrhea, which is about 2 to 3 days from the time of infusion. Readily manageable with appropriate anti-motility available agents that are available over the counter. So it's a drug that affects a number of key proteins and has shown activity as single agent in specific molecular subsets of non-small cell lung cancer. The study that we did was a randomized phase 2 trial. The goal was to see which subgroup of patients benefit from combination of Ganetespib with Docetaxel. So this was for patients with advanced stage lung adenocarcinoma. We randomized them to the combination or control arm of Docetaxel. 250 patients were enrolled, and it was 1-to-1 randomization. What we saw was that patients who got the combination had an improved progression-free survival and improved overall survival. Even more important and interesting was the fact that patients who came in with greater than 6 months from the time of diagnosis had almost a hazard ratio of 0.6 for PFS and overall survival with very significant p-values. And these were 70% of all patients enrolled to the trial, suggesting that this group derived the maximal benefit from the combination therapy. This is a large phase 2 trial, randomized phase 2 trial, and these exciting observations have now prompted a phase 3 trial, and this phase 3 trial will test the regimen against the same control arm. The main difference is going to be we will enroll only patients greater than 6 months from the time of diagnosis. 500 patients will be in the randomized phase 3 trial, approximately. Well, we hope to show that the combination extends survival for patients with lung adenocarcinoma. If you look at the patient landscape for lung cancer, in the salvage therapy setting, in the nearly 10 years, there's not been a single drug approved. And we've reached a plateau for those patients. Having a combination or a drug that extends survival would be a breakthrough for this patient subgroup. Well, if we show that the salvage therapy setting is associated with improved survival, then clearly we're thinking about how this can be moved to the upfront setting using Ganetespib as part of combinations. So that would be the next step as our research extends. We have seen very good tolerability of the combination. We're encouraged by what we see. There was nothing unanticipated that we saw in this randomized phase 2 trial. And given that we now have experience in a large group of patients with the combination, nearly 125 patients, we feel good about the tolerance. So we now have lung adenocarcinoma being viewed as distinct molecular subsets. You have EGFR mutation that accounts for 15%, ALK translocation accounts for 5%, and a slew of other abnormalities that are seen in 1 or less % of patients. So for specific subgroups, if you can have a targeted agent, we treat them. But that's only about 15 to 20% of lung adenocarcinomas right now. we still have 80% of lung adenocarcinoma patients for whom there is no proven targeted agent. So if we have a drug that broadly affects patients, I think it's going to be a very impactful lung cancer. Squamous cell carcinoma is a subset that's decreasing, fortunately, in incidence in the United States, and certainly we're seeing trends in Europe. We are now beginning to understand the genomic drivers in squamous cell carcinoma, and there are targeted agents being developed. It's following the same paradigm that we've used for adenocarcinoma, but I anticipate that we're going to have targeted agents for squamous as well, just not this particular drug. Brief practical take-home message for doctors is that the combination of Ganetespib and Docetaxel appears promising, and if you have the trial, please enroll patients and so we can get this phase 3 trial completed quickly.